Good afternoon. We're going to do things a little bit differently here today, so I'll introduce myself. I'm Governor Gary Herbert, and an opportunity for me to address the state and the media and the people of Utah. And I'll take that opportunity in just a few minutes. But before I start, I'd like to have introduced Dr. Angela Dunn, who will give her report today, and she'll be doing this through our Zoom technology. So, Dr. Dunn, I'm assuming you're there somewhere, and we'll turn the time to you.
I am here. Thank you so much, Governor. So, good afternoon. First, we'll start with the numbers. We are at 18,784 cases of COVID identified in Utah. That's an increase of 484 from yesterday. We've tested over 300,000 Utahns for COVID-19, an increase of 2,462 from yesterday. A total of 1,256 Utahns have been hospitalized for COVID from the start of this response. 167 are currently hospitalized due to COVID. Unfortunately, we still have 163 deaths due to COVID in Utah. That is the same as yesterday. Our 7-day rolling average of new cases every day is 487. And the 7-day rolling average of percent positivity is now at 9.8%. The good news is that we're still at 13% of cases being attributed to community spread, and that's been consistent throughout this response. So that means our contact tracers are doing an excellent job at really identifying all those close contacts to cases, reaching out to them, and enforcing quarantine and isolation. Our RT, or the transmission rate, is today at 1.35. Over the past 3 days, it's been about 1.25 to 1.35. I'd like now to turn to and talk about the analysis I provided last week to state leaders and public health partners that has received a lot of attention. The purpose of that document was to inform leadership discussions about how we might adjust our response in order to reverse this surge of cases. It was intended as a starting point for discussion and was written from one perspective, the public health perspective. My intention in the memo was not to say that we should shut down. No one wants that. My intention was to provide guidance on how we can continue to move the dial in the right direction at the right time. We absolutely need to be more vigilant now about social distancing and wearing face coverings in order to prevent overwhelming our healthcare systems. You know, I'm really proud to work in a state where I feel encouraged to provide my input and advice, and that leadership will consider it and weigh it alongside the input from other experts in their field. So we as Utahns should feel proud that leadership is willing to listen to all of these opinions and strike the right balance moving forward, protecting the health of individuals and the economy. With that, I'll turn it back to Governor Herbert. Thank you.
Thank you, Dr. Dunn. And let me just express my personal appreciation for Dr. Dunn for her service, for her expertise, for her counsel and advice. And we appreciate the good work that she's doing and has done and will continue to do. I want to start with a little bit of a sobering message here at the beginning. Maybe a sign of the times, maybe inevitability. We all know people that are touched by the coronavirus and contract COVID-19. And so today I'm announcing that one of my senior staff members has been tested for COVID-19 and is found to be positive. At the outset of his symptoms, he self-isolated. He did and followed the protocol that we all are taught to do while he was waiting for his results. We've worked closely with our Department of Health and other medical advice members to help us follow protocols and the recommendations that we've received and of expecting others to follow. All staff members who are exposed to this individual and for several days prior to the onset of his symptoms are being tested today and will be in self-isolation. Fortunately for me, I was not directly exposed during this period when the spread would have been most likely, nor was Lieutenant Governor Spencer Cox. Since early in the state's response to this COVID-19 pandemic, All members of my staff have been monitored for symptoms, and as they come into the office, they're checked, and they are required to wear face masks while at work. So that's an announcement. Again, we have this senior staff member that's come down with COVID-19. Let me speak today on a number of issues. And I want to make sure that as I speak to the people of Utah, that observations and certain points are heard. First, let me just say that all Utahns should be concerned about the increase in the infection rates and the increase in infections that we have throughout the state, particularly more of our urbanized areas and here on the Wasatch Front. They should be concerned because not only the infection rate increase, but what it does to our potential of our hospital capacity. Also, the data shows us that by the simple courtesy of wearing a face mask, as we do that in public, as we have our social gatherings together, and where social distancing is not possible, the wearing of a face mask is a very effective and low-cost way to prevent the spread of this disease. Consequently, we will emphasize even more than we've done in the past the need to have a personal responsibility that we all take upon ourselves to wear a mask at appropriate times. I will meet tomorrow with the leadership of our Unified Command, which includes Commissioner Jess Anderson, who's over our statewide public safety, General Jefferson Burton, who's heading the Department of Health, Dr. Angela Dunn, who's our state epidemiologist, as we meet in a weekly consultation review of the latest case numbers and hospitalizations as we make decisions. As part of this meeting, we will also review, which has been mentioned in the press and I've received just today, a copy of the request from Salt Lake County asking about making mask covering wearing a mandatory requirement. There is a process that we have in place. That process is for local government leaders, if they have a desire to make some adjustment to the current rules, regulations, the classifications that we have in this pandemic, that they work with their local health departments and work with our state health department to make that request. And if the data shows it, we've said we will in fact grant the request. We will meet tomorrow, but I can tell you, I'll emphasize to you once again that I'm a local control person. I believe that those closest to the people are in that local government arena and know what's best for them and their community at large. And so I would expect that if the data shows, proves out, the request we have from the county mayor and their council now, we've got a combined request that's come today, and with their health department's concurrence, the Salt Lake County Health Department, we will grant their request for them to be able to make it a mandatory requirement to wear a face mask in Salt Lake County. More information on that probably will come as we go forward on that issue. We also want to emphasize that we're taking measures certainly to work with our economic needs. As we've said from the very beginning, we have a balanced approach here in the state of Utah. We've not said it's one versus the other. It's not just the health versus the economy or the economy versus the health of the people. It's in combination of working for the best interest to protect lives and livelihoods. I appreciate the fact that we have an effort being made, and we'll talk more about this in a minute, from our chambers of commerce, are talking about a stay safe so that we can stay open approach. And clearly that's our effort, and what we'd like to emphasize, that we should have that as all of our goals. Let's stay safe, we can keep the economy open and still protect lives. So let me just give some elaboration on those observations that I've mentioned here and some areas that I want to emphasize today. From the beginning, we've talked about the need to manage the risk. There is no way to eliminate entirely all the risks that we have in society. Certainly not during this pandemic with the COVID-19 coronavirus. We've taken a balanced approach, as I've said, to see what we can do to accomplish both its really trying to thread the needle on an issue that there's not a lot of information that we had to begin with, and even although we're gaining more information now, still there's a lot of conflicting stories and conflicting recommendations and conflicting science out there. At this time, we mourn the loss of those who've lost lives. And it's an unfortunate reality of what's taken place during this pandemic. We also mourn the loss of jobs, that people are suffering because of a lack of economic opportunity. But I would hasten to add that because of the willingness of the people of Utah and others to, in fact, follow good common sense counsel, Utah has the lowest mortality rate and the second lowest unemployment rate in the nation today. So what we've done, although imperfect, has certainly in comparison been pretty good. But we still have a lot of room for improvement, and we're concerned about this increase in infections and why it's happening, and the hospitalization increasing, and the deaths that will occur if we don't, in fact, stem this tide of increased infection rate. I've met with state hospital leadership last week. I talked this morning with Dr. Mark Harrison from Intermountain Healthcare. We're getting their input, and we certainly have an understanding of their concern of this concern that they have of overwhelming the healthcare system. When we started out with this pandemic in early mid-March of this year, we said our first goal and objective was to make sure that we keep the control of the infection rate so that we did not overwhelm the healthcare system. And we've done, up until recently, a very good job of that. That's why we've had good outcomes. But the concern we have, and the hospital people are concerned, as we have increasing infection rates, more and more people go to the hospital. And it's not just a matter of the bed space that they're occupying, it's also the personnel that need to be there to treat them when they're in the hospital. When you're in an ICU unit, you need more, better qualified personnel. And we have a limitation more on personnel than we have on bed space. So that's a concern that I share. Angela Dunn has talked about that in her memo. We've talked to healthcare professionals, those who run our healthcare systems. That's a concern for them, and certainly should be a concern for all of us. So we are monitoring very closely to make sure that we do not overwhelm our healthcare system, and that capacity does not become a problem for us going forward in the future. We've used phased guidelines to guide the restrictions that we have throughout the state that Utahns are expected to follow. And we've always talked about our response in terms of a dial, not an on-off switch. Sometimes that gets confusing. I think with Dr. Dunn, when she talked about we want to shut down the economy completely, that was a misstatement. It's even when we've had at the very beginning, we've never shut down the economy completely. And we don't plan to shut down the economy now. We have a dial approach, which is gradually opening up the opportunity for the economy to grow and expand. And if we need to, we can dial it back. But it will be slow, methodical, based on data and with the balance of health and livelihood combined. So, again, I think we need to remember that approach as one of gradual, incremental adjustment. As I mentioned earlier, our original plea was to stay safe and stay home. That was our first iteration. And even then, we had the economy was permitted to move, and as we moved forward with precautions, and that process worked very well for us. And now we have some concerns with this dramatic increasing infection rate. I know it's been a little confusing with our guidance as we relax restrictions. Our personal responsibility should not loosen as we eliminate restrictions. In fact, our personal responsibility, if anything, should be dialed up. We should be more concerned as we interact with each other more commonly, as we've done in the past, making sure that we are washing our hands, using appropriate sanitation, social distancing, and where that's not possible, we should be wearing a facial covering. Facial masks are an important aspect of personal responsibility. And I don't mean just in personal responsibility looking out for yourself. I mean taking personal responsibility for those who are around you. and especially those around you who are of high risk. Again, defining high risk as those who are 65 years of age or older. They have underlying immunosystem problems. They could be obese. They could have diabetic. They could be smoker, tobacco use, anything to do with the lungs. Those that are medically frail are still at high risk, even as we are in moderate risk throughout most of the state. So again, personal responsibility is not just looking out for yourself, but it's looking out for those around you too. So as we've taken a look at this relaxation of our restrictions, some of our sparsely populated, our rural areas, we've in fact announced gone to green. There's really not much infection there, no deaths, and so we've talked about again in the beginning, we're not going to have a one-size-fits-all approach in this big, vast state of ours. It's going to be more regional decision-making and regional efforts, not a one-size-fits-all approach. And so we have done that in some of our rural and more sparsely populated areas of moving some of our counties to green. But today I'm announcing that in light of the increases of cases that we've seen here recently as they've spiked, we will not be considering application or for any relaxation of our color-coded guidance for the next 2 weeks. We'll take a look at the numbers and the data. We'll see how we do in stemming the tide of increase and turning it around and make some decisions. Yellow designation right now really allows for quite a wide open economy. There's not many things you cannot do in yellow. I'm concerned about the fact that we ourselves are not doing all we can do. As we mentioned in the beginning, if we have a plan, the success of that plan really is borne by us ourselves as we follow the guidelines. We don't follow the guidelines, the plan is not of much worth as we don't implement the guidance and actions that we should be taking as citizens. That takes me to the next area here of concern and maybe a renewed emphasis. We have a recent study by the National Academy of Sciences which indicates that airborne transmission is the dominant path through which the spreading of the coronavirus occurs. Droplets, whether when you're speaking, talking, singing, coughing, sneezing. We've all probably seen the slow motion videos of somebody sneezing, how many droplets come out and shoot out at very fast and rapid speeds, covering many feet of area and linger in the air for other people to pick up. A recent published compilation of 172 studies on the subject found that mask wearing significantly reduces the risk of viral spread. Again, I think that's intuitive to most of us, but the science backs up what we probably would suppose would happen with people having these airborne transmission capability for droplets that come out of our mouth and nose as we in fact interact with each other. I can understand too that sometimes this has been confusing. We've had some early public health officials that said, in effect, we don't need to wear masks. We've had conflicting science. We've had conflicting opinions that have occurred. That's been part of the challenge of how do we decide what do we do to, in fact, stop the spread of the coronavirus. But the consensus now is that masks not only protect the wearer, but it protects the people around him too. So it protects us and those that we associate with, and we need, in fact, understand that important aspect of what we need to start doing better than we've done in the past if we're going to stop the spread of this virus. I also understand that wearing a face covering is something that's not normal for us. It's not part of our culture. It's certainly not part of our habits. I oftentimes leave my office and have to go back because I forgot to take my mask with me. And so we have to change our habits and change how we think about going outside as we interact with people in the community. We're learning more and more about the virus each and every day. And we know that even people now that aren't showing symptoms can actually have the virus on them and spread it as asymptomatic people. That's again a change from the beginning of the outset of this pandemic. So that's why I strongly support the wearing of masks in public, and the rules of wearing a mask are really quite simple. Wear a mask at all times in any indoor facilities and settings and gatherings. Just wear a mask at all times in all indoor settings and gatherings. We find that the air shed as it recirculates probably is a little more conducive to spreading the virus than if you're outdoors. And then wear a mask outdoors when social distancing is not possible. Again, there are events and things you can do that you can have social distancing, and maybe wearing a mask is not needed. I would recommend people, hey, when in doubt, wear it. Rather than have to worry if you're 6 or 7 feet away from somebody, just have your mask on. I wear a mask every day at the office. I think it's appropriate. And I expect those who come to meet with me, which we do have people still coming to see and talk about issues throughout the state, I expect them to wear a mask also. If they don't have one, we'll provide one for them so that we both are wearing masks. I think I see it as a sign of respect for the health and welfare of those that you associate with. So it's not just about me, it's about people around me that I wear a mask. I also see it as a very simple and low-cost way for us as a state, as citizens, trying to stop the spread of this coronavirus to actually make it happen. It's not hard, it's not expensive to wear a mask, and it's simple and low cost. I would hope that we would all take a look at the data that we see today. I think there is some reason to be alarmed and take stock in our own behavior and say, what can I do to make it better? Am I wearing a mask? Am I doing the protocols that we've talked about that we all can probably recite in our sleep of washing our hands, social distancing, and wearing a mask? If you find out you have room for improvement, please make a commitment today to do better. Along that same line, that's why today, after consultation with the legislative leadership, I'm announcing that we will be issuing an executive order that will require mask wearing in all state facilities under the purview of the executive office. That's the office of the governor. And this will include state higher education facilities and our DABC outlets. So where we have control over it with our own facilities, we're going to require people to have masks when they come and do business with the state. Our employees there will be wearing masks, and we'll expect our customers as they come in to wear a mask also. By the way, this comes simultaneously as we see other groups rallying around this effort, this cry, and say, we want to have our people, in fact, to follow this same counsel and advice, and encouraging people to do it. I mentioned, just touched on in the beginning, about the Salt Lake Chamber of Commerce, who's got their Stay Safe to Stay Open program they are just initiating now. And they're going to take the pledge to say that we have a role to play as business entrepreneurs and business leaders to make sure that we have a safe place for employees to come and work. We also want to make sure, and we're asking the business community to make sure that they have a safe place for customers to come and shop. Again, that will be a major effort if we all join in with the business community and say, you know what, it's a safe place to work, it's a safe place to shop. That includes not only screening, testing for temperatures, washing of hands, hand sanitizers, but wearing of the mask. That's going to help us get on top of this spread of the coronavirus. Yesterday, I was pleased to see that the Utah Hospital Association launched their Mask Up Utah campaign. They will be doing some public service announcements of their own volition to tell people why it's important to wear a mask. Why is wearing a mask scientifically responsible to help us slow the spread of the coronavirus? And they'll try to educate us and help us understand the important role we play in wearing a mask. Again, these are experts in healthcare. They only have our best health at heart. They're concerned about our health and well-being. And so I appreciate that they're stepping up and launching their Mask Up Utah campaign to help remind us of the importance that we need to have of wearing face protection. And today, in addition to the other two, the Chamber, the business community, the Hospital Association, today I'm pleased to share with you a statement from the clergy of Utah that issued this following plea. And by the way, this will be made available through our webpage. You can see the signatories of the people on this. These are Christian and non-Christian alike, our faith-based leaders throughout the state. And this is their statement that they've allowed me to, in fact, release to you at this time. Quote, Over the last several weeks, we have seen alarming increases in COVID-19 infection rates in the state of Utah. The state epidemiologist has identified the lack of masks and social distancing as key factors responsible for this increase. As faith leaders, many of us have seen the effects of this virus on vulnerable persons in our congregations. COVID-19 has caused so many disruptions in people's lives, including mental, physical, and financial stress. We, the undersigned faith community leaders, appeal to people of faith all over the state to wear masks and practice physical distancing, sacrificing a small measure of comfort for the sake of saving lives. We recall that the greatest commandment is to love God, and the second is like unto it, to love one's neighbor as oneself. One cannot claim to love one's neighbor while deliberately putting them at risk. We pray for the end of this devastating pandemic. However, the reality is that our actions must accompany those prayers. Please join with us in continuing to take action to prevent the further spread of the pandemic by wearing masks in public and maintaining physical distancing. And it's signed by many, many faith leaders throughout the state. And I appreciate their willingness to step up and ask their followers and people of faith to act along with their faith and prayers to change their actions, to start wearing the mask and practice social distancing and proper protocol and hygiene. I also know that we've had some issues, probably that, again, I call them issues of communication, and particularly with our multicultural communities. The communities of color, they've been disproportionately impacted by this coronavirus. That should cause us all concern. It certainly causes me concern. I appreciate the efforts we've made so far in the state. We've had coronavirus materials, for example, translated into 22 different languages besides English. So there's been an effort there, but we need to improve that effort and increase the outreach. And so in that vein, tomorrow, here, we will host our first all-Spanish news conference and look forward to making those a part of our ongoing communications in addition to the simultaneous translation that we're already doing. This will be a concentrated effort that comes out of our COVID-19 subcommittee and our multicultural committees to try to make sure that they are understanding and we find out why they are having a higher rate of incidence than other parts of our state. By the way, with this being Spanish, our Latino Hispanic population in Utah is around 13 to 14% of our population, so it's not insignificant. So I'm grateful that we're going to be doing this all Spanish news conference tomorrow and an outreach to those people in particular. I've mentioned this also, but we can't emphasize this enough. The need to protect those who find themselves in that high-risk category. I've mentioned already, if you're over 65, if you have underlying conditions, if you're part of the medically frail, this is still high-risk territory for you. We've called it moderate risk, low risk, with yellow is the designation, but for them, it's still red. And we not only need to make sure that they are extra cautious themselves, take on that personal responsibility for their own well-being, but for those whose responsibility is to take care of them, that associate with them, that are around them, they need to be extra careful too. Those are the people that are most vulnerable. We see the high rates of incidence in those who are over 65. 70% of those who die are over 65. 90% of those who die in Utah are over 65 and have underlying conditions that make them more susceptible to more severe reaction to COVID-19. So again, I can't overemphasize the need for us to protect those who are most vulnerable. Communications is always a challenge. It's probably one of the toughest things in life. And we want to make sure that as we move forward here, that we broaden, we clarify, we diversify, we make sure that people have the ability to understand and then hopefully act on that informed information they have to improve better behavior. As we wrap things up along that same vein, I would like to say a few words about our decision-making process. Sometimes people wonder how this all comes about as we do this. It's not something that we just pull out of the sky. There's a lot of thought that goes into it. We have the best and brightest minds in the state to help inform us. The data that gives us information, the recommendations that come from very smart people like Dr. Dunn and others, and from all sides of the community. It's not just the health side, but it is the economic side. It's the education side. It's those in rural Utah. It's those in urban Utah. We need to get the advice and opinions and concerns from all aspects of our state. I'd like to say a few words on this decision-making process, and that's in my mind a little bit because some out there misrepresented the role and work of our COVID-19 task force. Why, I don't know. It could be for political reasons, because of ignorance. I don't exactly know why. But I want to make everybody clear about this group, the COVID-19 task force. This group was established in early part of March as our first reaction to this new thing that was coming to Utah. We saw around parts of the country and around the world this, what was then became known as a pandemic, and the COVID-19. We initially responded following the leadership and at least the model set by the President of the United States, President Trump, who put his second in command, Mike Pence, who is good at, as I know Mike very well, as a friend of mine, and bringing people together and disparate points of view and finding a resolution to difficult, complex problems. I followed that same example and put Spencer Cox, my lieutenant governor, who had shown his ability to do that in other circumstances. And I have great confidence in his ability to lead that group. I think they've done a good job. We've had some accusations that group has been sidelined. There's nothing to be further from the truth. They've done some really dramatic, important work. For example, the plan that we're following, the Utah Leads Together plan, which is the first in the nation, the most comprehensive written plan in America, came from that group, the COVID-19 task force. Again, assembling some of the best and brightest minds together to analyze and determine what is the way forward for the state of Utah. We have subcommittees that's come out of there. We just talked about the multicultural subcommittee that we're going to actually have some efforts on to better outreach to the multicultural. We have our economic response team that's talked about the economic aspect of this and what can we do to protect people's lives and still move forward to open up the economy. That's all come out of the COVID-19 task force. But as we've had this thing become more acute and needs change as we've evolved, as we've gone through this process, we found that you can't get a committee to come together as often as you would need to. Once or twice a week is not enough, with the demands being placed upon our state and our health departments and others to help us stem the spread of the COVID virus. So in that vein, we've in fact, since March 26th, the latter part of March, we in fact had the emergency situation occur where we stood up a level 1 unified command. So our emergency decisions and the work being done at that level under the direction of Commissioner Jess Anderson, who's our public safety commissioner for the state of Utah, General Jefferson Burton, who's taken over the responsibility of directing the Department of Health, as well as others. These members of the task force were critical in establishing this unified command. They helped this to happen. Now we meet on a daily basis. We review the data, we review the recommendations that come in from all quarters, including the task force, to make sure we have an informed and coordinated response on this issue. They meet every day. They meet with me not as often as that, but once or twice a week we meet as we're brought up to date as we execute on our strategy. I'll be meeting with them again tomorrow. This unified command structure, by the way, is not unique when it comes to emergency situations in our state. We use it in all kinds of emergency, have done so in the past. Usually they're on unique situations like earthquake. We've had fire, flood, microburst windstorms. They usually are for a limited duration. and they usually cover a few agencies and some jurisdictions. What's unique about this situation with the COVID-19 response is that our state emergency operations have been activated to the highest level, level 1, and been asked to, in fact, span a great area of responsibility. Their span of coordination is large and really enormous. They work across all state agencies. They coordinate with all federal agencies that are involved here, entities. They consult with the recently formed legislature committee, which was started by the legislature, called the Public Health and Economic Emergency Commission, which has a major role to play now with the legislature's input. They work with the COVID-19 task force still, continually, and its several subcommittees. And they work closely with our 13 regional health departments. There's been no standing down of effort by the state. In fact, there's been an increased and concentrated effort by this uniform command, where we're bringing everybody together, including the task force, which started the whole thing. So we're working very hard and working together to unify our efforts to make sure we're all pulling in the same direction. In spite of criticism we have on all sides of this issue, we're doing pretty well. Perspectives from the Utah Department of Health is a key component. Again, Dr. Angela Dunn, you hear on a regular basis. She meets with us on a regular basis. Other perspectives are important, as I've mentioned, our education, our multicultural communities, our mental health perspectives, our economic perspectives, a wide variety of people that want to weigh in, and we want to hear what they have to say. We had other issues that come along, along with the challenge we've had an earthquake, and about 1,500 aftershocks, that we have to, in fact, deal with the local communities. We've had recent protests. We have people disrupting our way of life, and that's a challenge for us as a state and local communities to deal with that at the same time, simultaneously. We've had 2 unprecedented special sessions, which we've had to deal with, and it makes it a little bit tough for us all to get together at the same time with all the responsibilities and demands that we have. So I can tell you, this effort that we've had by our unified command has been a godsend for us to intensify our efforts and unify our efforts to come together on solutions of how we, in fact, address the spread of the coronavirus. Let me just maybe sum up here now and say again, everybody, I think, is working in good faith. We have different perspectives and different points of view. We need to wrestle with those different points of view and see if we can come together in common ground and unify our efforts. We, the people of Utah, have a responsibility to do our best efforts. Let's listen to the best thinking out there, the best science, the best data, and then what does our behavior need to be to do our part to slow the spread of this coronavirus? We need to get on top of it so we can maintain and keep the economy open. We're in a good place right now. We have concerns about the spike and the trend that we see now, but we can turn that around, just like we did in the beginning. We can turn it around. This pandemic didn't come with any kind of a playbook. We have had conflicting recommendations from people around the country, from the scientific community. It's been a challenge for every nation, and still is a challenge for every nation. It's a challenge for every state in America, and it's still a challenge, and continues to be so. I don't see any let up in that, in fact, as we go forward. This is going to be a battle that we need to all engage in together and unite our efforts together if we're going to, in fact, overcome, which I think we can and will. The ultimate outcomes, which we're looking for, is protecting the lives and livelihoods of the people we represent in the state of Utah. And the good news is the outcomes we have heretofore are still among the best in the nation. But we see some troubled clouds on the horizon, and we need to make sure that we, in fact, recognize those concerns and address them. And we all have a role to play to do that. We've always said that this plan will only work if people will follow the guidelines. That means we have to do what we need to do to change our behavior, at least until we get the ability to have a vaccine and be inoculated and get some therapeutic medicine, maybe help treat those who get it. That, I hope, is coming. Talking to the White House just 2 days ago, they're hoping to have that happen by the end of the year, maybe the first part of next year. But in the meantime, we have responsibility to do the best we can to deal with the situation that we have without any special medicines to prevent us from catching the COVID-19. I believe that because we've had success, maybe the challenge that we have is we've had success economically, a lower rate of unemployment by 5 percentage points. We're at 8.5%, which is still way too high, but still compared to 13.5% that we have around the nation, it looks pretty good, and we're opening up. We've had a good news about flattening the curve, but we've become complacent, I think, because of the good news. So we need to redouble our efforts here and make sure we're not complacent, recognize the storm clouds on the horizon, and do our part to, in fact, to avert the storm. No one is more eager than me to see us to return to normal. Whether we can ever return to a normal as we've had it before until we get a vaccine, I'm not certain. We may have we call it a new normal, but certainly getting back to associating and interacting as we've done in the past is certainly possible. But it's going to take an effort on our parts to make sure that we take common sense precautions. And really, for most of these issues, washing of your hands, social distancing, having protective mask covering, those are mostly based on just common sense. We don't have to have medical studies to verify this is the right thing to do. And so I join with those in the business community of what they're going to do, leading by example. For the healthcare people are going to be doing PSA announcements and saying you should be wearing a mask, and here's why. It's going to help prevent the spread. And for the faith-based leaders are saying if you care about your fellow man, you will wear a mask. It's not just about you, it's about the people that we associate with. And so if we take these common sense precautions, especially through the mask wearing, that we can in fact stay open, return to a more normal way of life that we've enjoyed in the past, and still make sure that Utah maintains its position of being the best place in America to live, to raise families, and to do business. So we thank you for your efforts. We're successful because of you, the people. Let's redouble our efforts now at this challenging time. If we do so, I can promise you we're going to have great success. So with that, we'll open it up for some questions right now. I think Angela, Dr. Dunn is still with us. Is that right, Angela?
Yep, I'm still here.
Okay. Well, we'll open up. We'll take a few questions for a few minutes here.
Yeah, Governor, Ben Winslow from Fox 13. You say that you're inclined to grant Salt Lake County's request to mandate face coverings if the data is there, and you continue to urge people to wear them, and you've mandated it now in state-run facilities. So why not just mandate it statewide, like other states are doing right now?
Well, I don't want to predict the future. Like Yogi Berra, I hate to make predictions about the future. And it's a little uncertain. I will wait and see. There's a process that I really am committed to, so that every area of the state is treated the same. We want to have the request that comes for any of these adjustments to come from the local government leaders, where they have some ownership to this, working in conjunction with the local health departments, and then they bring the information to us, make the request, work with our state health department, and then we meet, and we'll meet tomorrow, by the way, and we'll make a decision on the request. I'm giving you a little bit of a hint that I'm a local government guy. I come from local government. You all know that. I believe in a bottom-up approach rather than a top-down. I think those people closest to the people on the ground probably know what's in their best interest. So that's the process, and I'm going to go through that process. We'll see what happens down the road. There may be other ways. We'll see if other people, other government leaders and their health departments together would like to make some adjustments. We'll see. I don't want to predict the future on this issue, and we'll just see what happens over the next few days. But again, I certainly am a big fan of wearing the mask. I wear it every day, everywhere I go, and I think other people should do the same.
Governor, at this point, is there any discussion about changing the restrictions back to orange?
That's always been on the table. As you know, when we started this effort, we talked in terms of moving from urgency to stabilization to recovery. We had 3 phases. Our second plan that came out of our COVID-19 task force came out and said we're going to now color code it to have a little broader approach. And we had red, we had orange, we had yellow, and then green. And we've gone through those first two so that most of the state is now in yellow. We have some of our rural areas which really social distancing is part of the norm there, a way of life. And there's no reason for them not to be in green. And so we've made that adjustment there. But we've talked about it's not an on-off switch. It's not off and now it's on and now on and now it's off. We've talked about it being a dial, something we do methodically, incrementally, and dial open, and we can dial it back. So that certainly is on the table, and we hope that doesn't happen. Again, these next 2 weeks will be somewhat critical. We'll see how people's behaviors change. We hope that they'll change for the better. And if we can get on top of this infection rate and turn it to go in the other direction, I would hope there would be no need to dial it back.
Governor, hi, Sean Means from the Salt Lake Tribune. Your fellow governors in New York, New Jersey, and Connecticut today issued a travel advisory saying that people from 9 different states where infection rates have gone up recently will have to sit in a 2-week quarantine before they can enter those states. Utah is on that list. Does that speak to what's working and what's not working with Utah's policy right now?
Well, for most of the time, what's working has been working. Again, I will compare our infection rates, our mortality rates, our economic expansion to New York anytime. That doesn't mean that we should put our head in the sand and ignore the red flag warning of increased infection rates. We're concerned about it. I expect everybody in the state should be concerned about it. If New York is concerned about it, that's good too. We're concerned about what has happened in New York, and we certainly have had a lot of people who have said, I'm not going to go there because of their high infection rates, and their mortality rates are 4 or 5 times higher than they are here in Utah. That being said, it's just an indication of concern, and we share that concern. So we're addressing that. We're, in fact, going to ramp up our efforts and lengthen our strides and put more emphasis on what we should be doing with common sense behavior. And I think the people of Utah will respond. I trust the people of Utah. They're good people. They understand what needs to happen here for us to stop the spread of this coronavirus and to make sure that we protect people's lives, protect those who are most vulnerable amongst us in our society, as well as keeping the economy open so we don't have problems that creates on the other side. It really is a balanced approach, and we're going to continue to take that kind of an approach, and I think we'll find success down the road as well as, if not better than any state in America.
Thank you.
Hi, Sonia Hudson with KUER. This is a question for Dr. Dunn. Is it a concern to you that the free testing sites in Salt Lake County are going to be shutting down for the next 2 weeks? Do you have any idea, how many people rely on that type of testing because it's free? Reaction to those sites shutting down.
Yeah, so we're working directly with the Salt Lake County Health Department to understand how we can better support them to make sure that all the communities have access to testing moving forward. So it really is going to be a balance between state and locals and the capacity of our laboratories to ensure that testing continues. I agree. I think it's really important that these communities continue to have access to these tests. We know there's even a bigger demand for getting testing statewide than there has been in a while. And so we want to keep those options open so that those who need a COVID test can get one as quick as possible. So we're working through those issues with Salt Lake County now.
So what are some of the options on the table for helping them? Is it helping them get more supplies, better coordination with the state lab?
Yeah, absolutely. The first thing is supplies. And so we're making sure that we're utilizing our resources in the most effective way possible. We have given them an increased number of testing kits so that they can continue conducting them. And then it's going to be about improving the efficiency of the actual specimen collection process. And that's where we're at now, is trying to figure that out.
And what are other options for people who would have wanted to utilize that, and they needed it to be, they really needed the free aspect of it. What are their options and where can they go?
So COVID testing is free for everybody. The CARES Act mandates that. So they can actually go to any of the testing sites, and you can find those testing sites on coronavirus.utah.gov. And there shouldn't be, or there won't be, any out-of-pocket expense for getting a COVID-19 test.
Thank you.
Sure.
Hi, Governor Tony Simrad with the Salt Lake Tribune. Have people in your office given thought to dialing back the state's tourism and travel promotion advertising that's in place in adjoining states in light of the surge in COVID cases? And if not now, at what point would you consider that?
You know, there has been some discussion on what should we do to promote travel and tourism. We happen to be blessed with a lot of wide open spaces. It seems to be clear that you're probably less inclined if you're in the outdoors to catch COVID-19, the coronavirus, particularly just a few of you out there in the wide outdoors. So outdoor recreation actually is not a bad place to be during this pandemic. We have better opportunities and more vistas and venues that are attractive than, say, some of the neighboring states. So part of the question is, should we take advantage of the opportunity that we have there? At the same time, the concern is, are we having people that come in from out of state, and are they going to maybe bring something in? You've heard the comment from New York about not wanting Utahns. There's the concern that people of Utah say of wanting people outside of Utah to come in and maybe bring in the coronavirus with them. So again, it's kind of a balancing act there too. Some of our local areas of the state really want us to open up and still continue to promote tourism and travel. Others, the localities, are saying not so fast, not as much. So we're trying to find out what's the best way to thread the needle, but it is a topic of discussion, and it's an opportunity, yet it can be a concern for us. So there's no really good or right or only right answer. It's probably going to be a combination of being careful, but still having tourism and travel. Certainly in-house, stay in place. We've encouraged, stay vacations. Many of the Utahns have never been to our 5 national parks or any of our 45 state parks. And so maybe an opportunity for us to get out and about in a safe environment for those of us here in Utah, as we will have less people coming from outside our state and certainly less international travelers than we've ever had in the last probably decade. Have we got somebody coming up?
Hi, Governor Brady McCombs with the Associated Press. To follow up on Ben's question about why you're not making a mask requirement statewide, what are your concerns with doing that? Your office said in a statement yesterday you worried that requiring them could create divisive enforcement issues. Can you elaborate on that if that's your concern?
I can elaborate a bit. The heavy hand of government sometimes has a negative reaction with the people. And we have people in Utah that don't need the heavy hand of government to, in fact, change their behavior or do the right and proper thing. Some maybe do, but I think most don't. And so I'm hopeful that we can get people to do the right thing for the right reasons because they love their neighbor and want to protect their neighbor as well as themselves from the coronavirus, and we'll do it on a voluntary basis. If it's going to be mandatory, it probably should come from the local governments themselves who represent the people and can be held accountable for whatever they decide to do. I think that's a better policy approach, and we're going to take a look at that as maybe the way to do this if we're going to have mandatory requirements for face masks. I know other states have done this by having the local people make the decision. We are not a one-size-fits-all state. I don't think that's good policy. I think better policy is to recognize the differences we have in the regional locations, the different environments we have, the population numbers, the cultures that we have in the different parts of the state, and let them make the determination whether they want to have government mandate it or not. So that's the approach we're going to take, at least in the near term. If things are necessary to change, we'll change them in the future.
Thank you so much. And Governor, this is Chris with Central News. Elaborating again on the mass situation, but on a local basis. You mentioned about being a local government guy, Victor Iverson in Washington County, he's a commissioner, he's also a lieutenant governor candidate. He says, I will never wear a mask, and he advocates no restrictions at all, not me, but just no restriction. Being as that as a local government situation, even if cases continue to rise in Washington County, we still listen to the local officials in that case?
You broke up a little bit. I think I understand that we have a county commissioner down in St. George area, Washington County, that says he'll never wear a mask. We have others like that who have said the same thing. I don't know that that's a very defensible position, certainly in light of what we hear from our healthcare providers, what we hear from the business community, what we hear today from our faith-based leaders. And if you love your neighbor, you probably ought to do what you can to, in fact, protect your neighbor, and wearing a mask is, in fact, a good protection. Overwhelmingly, the studies are showing us that wearing a mask helps not only protect our own selves from the coronavirus, but it helps us to not spread if we might not be symptomatic. We may be asymptomatic, but we still carry the virus. So it's a win-win. Again, people have their ability to follow. Good counsel and recommendations are coming from all sources, and if they reject it, they can be held accountable for that too. But we know that not everybody's in lockstep. I understand that, and that's one county commissioner that's not. We'll take one more question.
And in that case, just to follow up, in that case, I defer to someone else as well, but does that mean that you may not listen to local officials in that case if they advocate for a loosening of restrictions, even when cases are running?
Yeah, again, I'm not getting you quite as clear. If you're saying, does that mean in Washington County that we would have to mandate to Washington County because he doesn't want to have a mask? That's okay. Again, people are held accountable. Elected officials should be making these decisions when you, in fact, use government as the hammer to make people do things. So that aspect is right. And if the people of Washington County think that's the position they want to take as a community and support the fact that we will never wear a mask no matter what, then they will re-elect him to office. If they don't think that's a good position, they'll have somebody else. That's the process. That's how we have elections. So I don't have a problem. Again, whatever his position is, he'll answer the people. If they like it, they'll support him. If they don't, they'll replace him.
Yes, thank you for squeezing me in. I really appreciate it. I actually have two questions, but I think they're pretty quick. Governor, I'm sorry to pound on the mask thing, but we've spent 3 weeks listening to people complain about over-policing and police reform. And I just wondered if you had any concerns about once you mandate something or you make it illegal, then who's going to enforce that? And I know there's a county in Oregon that actually had to make an exception for people of color who feel like this is going to just be another target for them when it comes to policing. So I did have that question. And then also, do we have any idea if the protests have had any impact on these increases?
Say that last one again, Amy, I didn't hear it.
Sure. Do we have any idea if the protests have had any impact on the increasing numbers?
That's probably a question for Dr. Dunn. If we have, it's not been very large and significant.
Okay.
Again, maybe the advantages of being outside, but we'll let Dr. Dunn, maybe she can come in and answer that question. The first question was the wearing of masks and the enforcement. Clearly, that's a challenge. Again, I hear the requests from Salt Lake County, and it's kind of, we're going to make it a mandate, but will be kind of loosely enforced, and that's probably a good way to go about it. If they're not going to arrest anybody, they say they may find somebody. They'll have people gently try to suggest to, hey, you should be wearing a mask in this place or that place. And I think that's probably just good encouragement. There is an ordinance that says that, and then they will act accordingly. So I don't think we want to have this too draconian, and I don't think anybody intends it to be. That's why I'm saying I hope people will just do it without government's heavy hand, other than the fact that I love my fellow man. This is common sense. I'm going to wear a mask because I'm showing respect for those around me, and they're showing respect for me. It's a two-way street, and I think that's the best way to get it done. The law enforcement are going to have to decipher whether, in fact, somebody's wearing it appropriately or not wearing it when they should, and are they 6.5 feet away as opposed to 6 feet? And so there are some, I think, enforcement concerns which are real. part of the logistics of it is a challenge. I don't, whether a person's of color or not should not matter when it comes to law enforcement. Again, if people wear a mask because they're protecting themselves from the virus and protecting their neighbors, that shouldn't matter to anybody in law enforcement. It shouldn't matter to the people that they're associated with. And nobody, no matter what the color, whether they have a mask on or not, should be afraid of the police. That's part of what the protest is about, and we're going to be working very diligently and carefully with those communities of color to make sure that they are not afraid when the police approach them on any issue or for any issue, and that's the way it ought to be. We ought to be treated as a colorblind society and equal before the law and equal before our neighbors. So with that, Dr. Dunn, do you have any information on any increased infection rate with the protests? I know that's been an area of concern around the country. How come the police didn't break that up? If we can't socialize and have to social distance, didn't happen with the protesters. And so has there been an uptick in the virus?
Sure. So the protest happened about 3 weeks ago, and we've only identified a couple of individuals where we couldn't identify any additional place where they could have been exposed to the virus. So it's only been 2 thus far. And having the protest be 3 weeks ago and our case count has maintained a steady increase, we don't think that the protests are contributing or have contributed significantly to our outbreak beyond just routine community spread that we're seeing statewide.
Okay, with that, again, I think that we'll cut it off right here. We appreciate, again, those who've been in attendance and the people of Utah. We always say stay safe and stay strong. Really, the answer to this is all of us working together. This is a call to arms. This is a call to action. And if we will all do better, lengthen our stride, do better than we've done before, wear the mask, socially distance as appropriate, wash our hands, we can stem the tide of increasing infections. We can do it, and we will do it.